Hello, I'm Clara Mayunga, and I'm a community pharmacist in the Netherlands. And I'd like to welcome you to this topic of the CPD Bite, a patient-centered approach to managing common ailments in community pharmacy, a guide for early career pharmacists. The learning objectives of today's session are to understand patient-centered care in the context of common ailments, to learn how early career pharmacists can integrate clinical evidence into everyday consultations, to learn communication techniques that engage patients, to understand common barriers to patient-centered consultation, and to learn strategies for enhancing patient education and supporting informed self-care decisions. In community pharmacy, pharmacists spend a lot of time managing common ailments such as pain, respiratory, and reflux management, besides dispensing, compounding, and counseling. But how do we ensure our approach remains patient-centered? Patient-centered care focuses on the patient and the individual's particular healthcare needs. The goal of patient-centered healthcare is to empower patients to become active participants in their care. It requires pharmacists to develop good communication skills, effectively address patient needs, and provide care that is effective and safe. According to the summarized literature findings in the FIP 2023 report, patients reported enhanced quality of life, symptom relief, and triaging to GPs as a result of consultation with a pharmacist. This in turn reduces the workload for the GP and strengthens cooperation between healthcare providers and primary care. However, early career pharmacists might experience some barriers in managing common ailments because of 1. Time constraints, busy community pharmacy settings, workflow interruption, and demand peaks can serve as key barriers to delivering ideal care. A second point we can make here is lack of confidence and lacking experience in clinical decision making. The third one is limiting training and communication skills with patients, but also with other healthcare workers. The last one we can mention is the systemic and organizational barriers. The workplace may not prioritize clinical conversation or lack of consultation rooms, which provide inadequate privacy. Awareness of the challenges allow you to approach them proactively and transform them into strategies that support effective consultations. A way to improve the minor ailment consultation as early career pharmacists is to apply clinical evidence to ensure patient safety and effectiveness of treatment. As mentioned before, during common ailments and brief OTC consultations, it is important to work together with the patient to create a patient-centered plan. Throughout consultation as a community pharmacist, there's a need to assess the symptoms and red flag signs. Red flag symptoms should not be self-managed, and the patient should be referred to their GP. To achieve this well-structured consultation, translate evidence into actionable pharmacy practice. This had been done on the local and national level. For example, the lead pharmacy access to self-care or the common ailments protocol by the Canadian Pharmacists Association. Also, FIP provides quick guides on some of the most common ailments. FIP doesn't endorse guidelines, but these are good practices. It is important to note that one should always check regional and national guidelines first. Common ailment schemes may vary by region or may not be even part of the country's healthcare system at all. Two of the most commonly encountered symptoms in a community pharmacist will be briefly described using FIP guides. The first one is sore throat. Common symptoms can include pain or scratchy sensation in the throat, difficulty swallowing, swollen and red tonsils, a hoarse or muffled voice. On the other hand, the red flag symptoms could be fever higher than 38.3 degrees, with or without the shaking, chills, and the night sweats, a sore throat that's severe or lasts longer than a week, frequently recurring sore throats, and swollen regional lymph nodes. The second example we will mention here is the reflux symptoms. Common symptoms include heartburn, coughing, chest pain, loss of appetite. Red flag symptoms are difficulty in swallowing, gastrointestinal bleeding, unintentional weight loss, anemia. Presenting the symptoms side by side support decision-making whether to provide the patient with self-care advice that include non-pharmacological or pharmacological advice, or to refer them to the physician. Whenever there is uncertainty or lack of sufficient knowledge on the subject, referral to the patient's GP is always recommended. Furthermore, always keep the regional and national guidelines in mind. There are not only guidelines which provide evidence-based advice on common ailments, but also the types of questions that can be asked to gather information about the patient's self-care concerns. This will support the differentiation between common and red flag symptoms, enabling tailored advice for the patient. Hereby an overview of some mnemonics for structured questionings for providing a basic structure when communicating with patients. Examples of the models are Quest Cooler frameworks or the WAM. The WAM is simpler and widely used in the UK, and the Quest Cooler MAG frameworks are more used to train pharmacy students and pharmacists in the US and Canada. Also, each of these approaches is valuable in guiding information gathering during patient consultation. Individually, they do not provide a complete structure for questioning. A more comprehensive assessment can be achieved through the combined use of Quest and Schooler MAC. Structured questioning is a method that early career pharmacists can use in an evidence-based consultation to support patients in making informed self-care decisions. It enables the clear explanation of evidence to patients and guides them to a trustworthy health information websites, thereby enhancing patient engagement and empowerment. Let this be an encouragement for early career pharmacists to actively participate in continuous professional development. We can achieve this by participating in mentorship programs such as the one offered by FIP ECPG. This initiative facilitates interaction with experienced pharmacists, empowering us to learn from real-life practice and refine our approach to patient care. On the website, more resources can be found for the development of early career professionals. This includes research that is aimed in quality improvement with common ailments, programs enabling pharmacists to evaluate service effectiveness and enhance the quality of patient counseling. Furthermore, FIP made different resources for professional development available online. Tools that can be found are webinars, reports, handbooks, FIP CPD Bites on different topics such as self-care support and counseling framework. To summarize today's session, patient-centered care in common ailments should be evidence-based, empathic, tailored to individual needs. However, this requires time, experience, and skills training. The use of guidelines is essential to ensure structured and high-quality consultation that lead to safe and effective treatments. Referral to a GP is necessary when red flag symptoms are identified, when you feel uncertain about the correct course of action, or when it's outside your clinical competence. And early career pharmacists can enhance their role in self-care support by participating in continuous professional development offered by FIP and the FIP Early Career Pharmacist Group. Thank you.